Hi everyone, I'm Nichelle Jensen. I'm currently working at a community hospital, about 250 beds. I started off in the intensive care and I worked there for about 7 years. Critical care is my main background. I just recently switched into a clinical coordinator role for nursing education within the hospital, so it's been very exciting, my new role. Um, I was excited to hear that we were going to have a nursing informatics class. About the last year, I've been helping our system implement the Epic electronic medical record, and it's been very challenging but very fun and interesting. And now our next project is to help implement the CPM or clinical practice model system into our EMR, which gives nurses the evidence-based practice and guidelines and care plans to help guide their practice. So it's been very exciting. Um, One of the things that I would like to see come down the pike for nursing would be possibly, taking all this loads and loads of information that we put into the electronic medical record, and maybe developing some sort of early warning system for trends in patient data that could possibly alert us to potential problems for the patient. For example, trending and watching the patient's heart rate or WBCs or blood pressure, temperature to notice the patient maybe having some early signs of sepsis, and then maybe giving the nurse some indications on what to do next, draw lactate or draw cultures, things like that, so that the interventions can get implemented sooner and possibly have better patient outcomes. The other thing that I was thinking of is, and this may exist, I don't know. Right now, our current continuous telemonitoring does not transfer into the patient record. We have to print strips and measure them and then scan them into the patient's chart, which is very time consuming. So it would be nice if our EMR communicated with our bedside tele or our 12-lead EKGs, and they would be, automatically downloaded into the patient's electronic medical record. And that way we would not have to worry about having to scan them in and potentially losing information if the scanned document did not turn out. And then possibly incorporating my first part for the early warning system by doing some measurements and watching the patient's trends, and alerting us if the QT was lengthening or things of that nature, so that we could possibly intervene before it became a problem. So those are some of my suggestions. Thank you.